All right, well, thank you everyone for attending NAPSA's Research to Practice Fall webinar on recommendations for improving communication between APS and reporters. This webinar has been organized by NAPSA's Research to Practice Interest Group, and I'm Esther Thorpe, the Administrative Assistant with NAPSA, and I'll be moderating today's call and happy to welcome you on behalf of NAPSA. For those of you who are not aware, NAPSA, or the National Adult Protective Services Association, is a nonprofit membership organization that exists to provide training, advocacy, and networking opportunities for APS workers, allied professionals, victims of abuse, and anyone interested in preventing and raising awareness of elder and adult abuse. Please feel free to visit our website, www.napsa-now.org, to learn more about us and become a member. Just so you're aware, if you'd like to join the Research to Practice group, please feel free to email me at info@napsa-now.org with a note requesting to join the R2P Google Group listserv. You do not need to be a member to join, but we do encourage people to join the NAPSA membership. And just so you all know, all the listeners have been muted, but we do encourage you to ask any questions in the chat. And after the webinar, we'll have about 20 minutes for people to unmute themselves and ask any questions as well. Today's presentation will be recorded and it will be on the NAPSA website. So yeah, just be on the lookout for that, hopefully early next week. And I will go ahead and pass it on to the speakers to now introduce themselves and begin.
Thank you, Esther. Hi, everybody. I'm Kristen Lees-Haggerty. I am a project director and researcher at an organization called Education Development Center, or EDC. Before I hand it off to my colleagues to introduce themselves, I'll just tell you very briefly who we are at EDC. EDC is a global nonprofit research and development organization. We do work in all sorts of things, from early childhood development to workforce development, and we have a whole portfolio of work in aging. And the work we'll present to you today is within our work in aging and focuses specifically on elder mistreatment. I'm going to hand it next to Nike to introduce herself.
Thank you, Christine. Hi, everyone. I'm Nike Ojalabi. I'm an associate project director at EDC and super excited to be here with you. And I'll hand it over to my colleague, Randy.
Hello, everyone. I'm Randy Campetti, and I'm a research assistant with EDC. Kathy?
Hello, Kathy Greenlee. I'm the Senior Director of Elder Justice Initiatives at Advancing States, which is the national membership association that represents States Department on Aging, Disability, and the Medicaid Home and Community-Based Services programs. I previously served as U.S. Assistant Secretary for Aging and have been part of this project from the beginning, so it's delightful to join you all today. Let's see, Achilles.
Hello, everyone. My name is Achilles Cerrone. I'm the Adult Protective Services Program Director for the City and County of San Francisco, and I also chair the Consistency Work Group. We are county administered in California, and so I lead this Consistency Work Group so that we can be more consistent in practices. Thank you.
And Reza, is that who's next?
Yeah. Hi, everyone. Reza Zainalpour. I am the Deputy Director of Community Living, Aging, and Protective Services in Oklahoma. Happy to be here with everybody. Esther.
Oh, hi, I'm Esther, the Administrative Assistant with NAPSA.
All right, I think that's our team. So, Nike, do you want to go ahead and share screen? Okay, thank you so much. So today we're presenting our recommendations for improving communication between Adult Protective Services and reporters. This is an NIJ funded project that we recently wrapped up in June 2023. We all just introduced ourselves. So the EDC team is here. Kathy Greenlee is an expert consultant on the project. Achilles was on the executive advisory board, and Reza, we met during the process, the research process, as we developed the recommendations, and are thrilled that he can join us to tell us more about what's going on in Oklahoma. So next slide, please. So we'll tell you a little bit about the background for this work and our research methods. We'll have a couple of panels during this presentation. We'll talk to Achilles and Reza about why they wanted to be engaged in this work. We'll share our findings and the resulting recommendations, and then hear from the panel again about practical implications. And next slide. And next slide again. Thanks. So before we get into the research piece, I did want to mention that we've been here before on one of the NAPSA Research to Practice webinars presenting our work from the National Collaboratory to address elder mistreatment. The National Collaboratory is a group of expert researchers, clinicians, and advocates who came together with the goal of developing, testing, and now disseminating a care model for addressing elder mistreatment in emergency departments. And during the process of developing and designing that model, we worked really closely with Adult Protective Services and clinicians and other types of mandated reporters of elder mistreatment. And so the idea for this current project, this NIJ-funded project that we'll be spending the bulk of our time talking about today, the idea for that really came from these ongoing conversations that we've had with people describing their experiences with communicating with each other, mandated reporters and Adult Protective Services. So I wanted to acknowledge that. Recognize that we have been here before and shared some of our work before. And then if you go to the next slide, wanted to share these resources from the National Collaboratory. So at EDC, we've been working in a number of ways around elder mistreatment prevention, identification, and response. And we address it from a few angles with training and tools for mandated reporters to use to identify elder mistreatment. We have training on the role of Adult Protective Services, what APS is, and really importantly, what it is not. And we encourage mandated reporters to be more proactive in establishing relationships with Adult Protective Services and other CBOs, community-based organizations in their communities, so that they have a number of ways to try to keep older adults safe outside of the clinical settings in which they're working. I am going to turn it now to Randy to give us some more specifics about the background for the NIJ funded project that we're going to be focusing on today.
Thanks, Kristen. So one of the major barriers to elder abuse reporting and response is a perceived lack of feedback from APS to reporters on reports that they make. And so what we've heard from reporters is that if they don't get feedback from APS on whether they're identifying abuse correctly or how APS is intervening in the cases that they're reporting, then they might be left wondering if their concerns are valid and if their issues are going to be addressed. And so without this information, reporters might feel like they're discouraged from reporting again, and especially if they're seeing the situation not change as they're seeing the older adult over and over again. But on the other side, APS staff have expressed concerns about legality and ethics of sharing information about cases with reporters. And they also often lack staff capacity to provide feedback on all of the reports that they're receiving. So to try and help address this issue, the National Institute of Justice provided funding to EDC to conduct research so that we can better understand legal, ethical, and practical barriers and facilitators to APS reporter communication at key points along the reporting process. And so we use these findings from our study to develop some recommendations on how we might be able to improve the relationships and communication between APS and reporters. And we'll be sharing those with you a little bit later. Next slide, please. So here's just the methods that we use. So our study involved two components. First, we conducted an environmental scan of policies and practices that were related to APS and reporter communication across the United States. And this involved reviewing publicly available information and conducting a secondary analysis of data from focus groups that were with EMS and APS staff, and also conducting some individual interviews with state APS leaders. And then secondly, we conducted a more in-depth case study in Massachusetts to assess APS caseworkers and reporters' perceptions of some recent policy changes that did affect communication. So I'm going to hand it back to you, Kristen.
Thank you very much, Randy, for that nice setup. So now we're going to move to just a brief panel moderated by Kathy, where she's going to just engage Achilles and Reza in their motivations for participating in this project. Kathy?
Awesome. Thank you. Thank you, Kristen. So like many grant-funded projects, it was important from the outset that we put together a group of expert advisors as an advisory board to help us both as we shape the project and then towards the end of the project to re-engage or engage directly with states to kind of test out our ideas. So Achilles, I reached out to you early as we were putting together the advisory board, and we were so thrilled that you helped us. Will you kind of help share with everyone else what your experience had been up to that point with regard to your need to provide feedback to reporters, the success of how that was working in San Francisco, just the general dynamic that you'd been experiencing with regard to feedback?
Yes, of course. So in California, we have 58 counties, and because we're county administered, or experience similar to other states who are also county administered, that there is a variation on how regulations are interpreted, best practices. Back in 2001, there was an all-county letter explaining how to provide feedback to whom as a mandated reporter, for example. And it was vague and broad, providing some guidance. So for a number of years, counties developed different practices. And as it happens often, a group of professionals and leaders from every county got together and tried to figure out, is there a better way of figuring out who to report back to and what in terms of a reporting party? So this consistency work group that I had been leading got together and discussed some various alternatives, and we came up with some guidelines to supplement regulations, and with various examples, yet not enough guidance to be consistent, but enough to equip counties to think through the response. And yet you think of, what is really the best practice? What should we all be doing? In San Francisco, for example, we had the practice of contacting the reporting party at case closure. And then we stopped that practice like around 2018. We were, as a result of new guidance on investigation, calling every reporting party at the initial investigative stage. So these decisions that are made are really based on what the current assessment of the time is. So when you invited me to join this panel, I thought, well, maybe there has to be a better way or some more methodical assessment of what a best practice should be. And so we can contribute or trajectory or journey in California and see, what value it has for this project and what we can learn from it and what we can improve.
Awesome. We are so glad you're here today and that you were part of the advisory panel. I think it's interesting, Achilles, that you mentioned the who and the what, because that became central to the model that we developed. What should be provided and to whom, and that is very central. And part of what we'll go through this morning as we go through the rest of the slides. As we kind of came up with this model, we needed to let's go try this out. Reza, I'm in Kansas City. It's like, let's go to Oklahoma. So we reached out to Oklahoma. You all were quite receptive, and it was wonderful I drove to come down and visit you. But what had been happening at that point in time? What had you noticed about this dynamic in Oklahoma with regard to the need to provide feedback to reporters, or the tension if you didn't provide feedback? Just kind of what was the atmosphere there as we approached you all about working with us on this project?
Yeah, absolutely. So, when we get a report, everybody wants to know that something is happening. And, the constraints of the time that we have available to reach back to everybody, sometimes that's a really big challenge. And so partners, reporters, they may get the perception that we're not doing all that we can, when in all actuality, we're just saturated with the amount of work and we're constrained on how we might how we might provide that kind of feedback, because but it was a challenge that we're still trying to tackle, you know, and I have a few slides a little bit later on. But, you know, whenever we look at these competing requirements and what outcomes we currently have, we think to ourselves, well, how do we get better? As opposed to just saying, well, that's the way it is. So that's kind of been our drive and motivation on why we need to tackle this and the reason why we're going to push forward. What was the second part of your question?
I just wanted to know how things were. I know you've got time to talk about how you're going to tackle this in the future, but one of the reasons we wanted to at least briefly stop and talk to you and Achilles, Reza, is that we know that the experience that both of you have had, one at a state, one at a county, is pretty universal. As we had done the interviews with all of the states, as we'd workshop this in other states, that the frustrations are very common. And that's what we hope to address with the model, and some guidance that we can give people, at least on our thought process on how to kind of move forward with improved practice. So thanks. I know we're going to hear more from you. So Kristen, I'm going to turn it back to you.
Thanks so much. Thanks, Achilles and Reza. And while Nikkei pulls the slides back up and we get back into the research part, I'll just say that it's just so important. You know, this is a research to practice webinar. And so we're trying to really remind people of ways that we can do research and keep it grounded in the realities of real world experiences. So we were grateful to everybody. And you'll hear later that there are other states also that gave their time to help us reality check ourselves as we continued this work. And so over to Nikkei to talk about what we found on the research side.
Thank you, Christine. Just a moment, just move things around here. So yeah, I'm going to be, thank you, Kathy, Reza, and Achilles also for your great insight and contribution to this work. So I'm going to take us through the details of the research and our findings. And as Randy mentioned earlier, this research seeks to address inadequate communication between APS and reporters on the reports they make. Essentially, our goal is to understand barriers and facilitators to providing feedback to reporters, and also develop recommendations to improve the feedback loop between APS and reporters. So I'm going to take you through some of our, our initial thoughts in the beginning of this project. So previously, the previous research in this field, specifically evaluations conducted by APS TAC, which means Technical Assistant Resource Center, examined APS policies in details. They've examined APS policies, practices, and outcomes that have helped to advance our understanding of the administrative structure, reporting, intake, and investigation process of APS. But very little is known about APS's feedback policy and practice. And really, this is the focus of our research. So we started out with a very broad definition of what feedback from APS to reporter can be. We considered, we first of all considered how, in what ways and manners in which APS would relay information to reporter after a report is made. We also sought to understand when in the process would APS provide information to reporters. And we've learned in doing this work that feedback can be provided throughout the reporting phase, beginning from the intake through the case closure. We've also learned that most of the feedback happen at intake, and the least feedback to reporter happen at case closure. In addition, we also considered why. Why would APS want to provide information to reporters? Why would they want to share? What would motivate APS to share information with reporters? So throughout our research, we've really worked to refine the definition of feedback and also better understand the what, how, when, and why information would be shared with reporters. So like Randy mentioned earlier, we had these two main categories of our research work. We first did an environmental scan, and then we did a case study focused in Massachusetts. So with our environmental scan, we first of all started with reviewing publicly available information. And we observed that policies related to feedback vary across states. So some states provide feedback to all reporters, while some would only provide feedback to mandated reporters. And this is regardless of the state's reporting policy. So whether a state has a universal reporting policy or not doesn't really matter. It just from the different states, we found that some states would provide feedback to all reporters and some only to mandated reporters. We also found that the types of reports, the types of feedback provided to reporters vary. And we classify them or categorize them into two groups, one being procedural feedback and the other substantive feedback. And by procedural feedback, it refers to feedback that's provided to reporters, mostly at intake and during the investigation. And this type of feedback focuses often on the process, the pathway process. That's what it mostly focuses on. An example would be that a reporter may receive a letter, a call, or an email from APS notifying them that the report they made was received, under review, accepted, or not accepted for investigation. We also have the substantive type of feedback, and this really focuses, it takes place often at case closure and after investigation is completed. And this type of feedback focuses more on the outcome of the investigation. So for example, a reporter may receive a letter notifying them that a case was substantiated or not, that the victim have been referred to services, or that a case is closed. So far, we've learned from our review of publicly available information that the feedback process between APS and reporter is really more complex than what we have on the screen right here. It may not necessarily fit into procedural and substantive categories. So in addition to our publicly available data, we also conducted a secondary analysis. In our secondary analysis, we were able to get perspective, especially EMS's perspective of feedback to reporters. And in our secondary analysis, the reporters suggested that they would rather like to better understand the reporting process. Like you can see on the screen, one participant actually noted there is a gap in understanding of the process, of how the process works together. Another reporter noted that they would desire some type of feedback from APS. And one of the participants described it as, we need positive reinforcement. We need APS to reinforce to us that we are making the right report, we are doing the right thing when we send in reports to APS. Lastly, they want a clarification of what to expect. What should we expect from APS when we make a report? And as you can see in the screen, here is what you should expect. You know, they want to be able to say, here is what we should expect. So when they're sending in report to APS, they have an expectation of what they would get back from APS in terms of feedback. So in addition to all of that, we also conducted interviews. We spoke with 44 APS leaders from 24 states. And the goal is to better understand their current policies and practices around feedback and to understand what are the perceived barriers to communicating with reporters. So generally, APS agencies are aware of reporters' desire for feedback. They understand that reporters want feedback on their reports, and they recognize that there are benefits to providing feedback to reporters, such as it helps to reduce unnecessary callbacks when you provide feedback to reporters. It's also an avenue to educate reporters and to strengthen their future reports. It's also another opportunity to strengthen reporters' relationship with APS. However, the priority for APS agencies are to protect the privacy of the older adult. We had this over and over and over again. APSs understand the benefit, but they seek to protect the privacy of the older adult. They want to avoid backlash from APS, so backlash from the report, from the older adult, and also from the reporters. So they want to provide the privacy of the older adult, maintain confidentiality laws, and most importantly, or in addition to all of these, there's limited resources to do this. If APS were to provide feedback to all reporters, they do not have enough resources to be able to do that. So they're maximizing the resources that they have at their disposal. However, it's from all of this, if feedback were to be provided at all, if APS were to provide feedback to reporters, two main factors play a big role. From our research, we understood that the reporter type and the quality of relationship that the reporter has with the older adult are key factors in APS's decision to provide feedback, and also in the kind of feedback, the type of feedback that APS would share with the reporters. So I did mention earlier that we had two phases to our research. We had the environmental scan and we had the case study focused on Massachusetts. So now we examined, the cross-state environmental scan that I discussed earlier. Then we focused on Massachusetts, trying to understand how this applies in a local context. So we chose to focus on Massachusetts because they have made a recent policy change that has some relationship with APS reporter communication. And the policy changes include a centralized intake line, a web-based reporting system, and also financial incentive to encourage agencies to provide feedback to reporters. So in Massachusetts, we conducted 10 focus groups and interviews with 16 APS staff and 14 mandated reporters. The mandated reporters cut across different groups. They include social service providers, healthcare providers, law enforcement, and assisted living managers. The APS staff also span across years from less than 1 year in the field to about 20 years in the field. They included screeners, caseworkers, supervisors, and directors with several years of experience. And from our Massachusetts case study, we found that there are three main points or themes that evolved from this Massachusetts case study is their reaction to the policy change. There is a mixed reaction to the policy changes in Massachusetts. The centralized intake line was received, but it has its pros and cons. For example, it's convenient. It's convenient for reporters to have a centralized intake line to make their report. However, it also takes away from the relationship, the personal relationship that reporters have with their APS staff, and that relationship enables them to be able to trust in making reports and to expect some kind of feedback. But having a centralized intake line, takes away from that type of relationship. Also, APS participants described that the centralized system, it relies on staff, and some of those staff that are involved in the centralized intake line do not have all of the expertise to engage reporters when they call in to make reports. Another theme that evolved from there is the collaboration piece, which I kind of alluded to it a little bit, collaboration and the complexity of clients' confidentiality. And here there's a mutual interest in really building relationship. APS as well as reporters want to strengthen their relationship, but the changes that has been made could strengthen relationship in some way, but also, like I described earlier, allows for a detach from the local context where a reporter do not have the access to the local staff as they would ordinarily have. Then we also heard about there's need for training. There's need for training. A lot of the APS staff made us understand that they need training for those who are receiving the intake line, those who are on the intake line. They need to be more trained on how to receive these calls, on how to encourage reporters. There's also a need for public awareness. Improve access to the frequency of mandated reporter training would continue to encourage both APS staff as well as the reporters to make reports in the necessary ways. So I'm just going to move on now to really what we came from all of our research, from all of this research that we conducted. We came up with what we call an APS reporter feedback model. And I'm going to take us through this very slowly. So we have a model describing how APS, making a suggestion of how APS can provide feedback to reporter. Decisions about whether to share information with reporters boils down to the perceived benefit or reward that to client as well as to APS. And as shown in the column here, we weigh this against the perceived risk and burdens to both clients and APS. So the perceived risk and benefits to APS depends on a couple of factors. Like I mentioned earlier, one is the reporter type, and then the quality of relationship that this reporter has with the older adult. And when I talk about the reporter type, this could be, as we have in the slide on the screen, whether they are professionals versus non-professionals. And then the quality of relationship could be brief involvement or an ongoing relationship with the older adult. So this model shows that APS is most likely to provide feedback when the perceived risk or burdens are low and the perceived benefit or rewards are high. So I'm going to walk you through each type briefly to provide more context. So let's take a look at the non-professionals with brief involvement. They are the least likely to receive feedback from APS. They are non-professionals like neighbors, family, or friends. And they may be mandated reporter or non-mandated reporters, depending on the state statute. But the key point is that they are uninvolved or only briefly involved. These are reporters who do not have an ongoing relationship with the older adults in the way that can help to improve care. Hence, the burden of providing feedback, the burdens or risk associated with providing feedback to this type of reporters are higher, and the benefit or reward are lower compared to other group of reporters. Then we have the professionals with brief involvement, and you can take a close look at the quote. And these professionals with brief involvement could include professionals like physicians, social workers, and usually they are mandated reporters who are uninvolved or only briefly involved with the client. That is, they do not have a continued interaction or involvement with the older adults, even though they are professionals, which makes the benefit of providing feedback potentially lower than if they are not professionals. However, there's still a risk in sharing feedback with this group of reporters because they do not have an ongoing relationship with the older adults. We have the other group, which are non-professionals with ongoing involvement. And these are often family and friends who are involved in the care of the older adults. And because of their level of involvement, there's more potential benefit of providing feedback to this group of reporters. However, there's also a huge risk in providing feedback to this group of reporters. So APS, this is where APS will provide some recommendation. Afterwards, we're going to be sharing some recommendations. This is where APS need to apply, skills in order to determine whether or not to share information with this group of reporters, because it could be inappropriate to share the report with this group and halt the investigation, and it could be helpful as well to share information with this group to advance the investigation. So skills is needed at this point. Then we have the last group of reporters. These are professionals with ongoing involvement, and they are the most likely to receive feedback from APS. They are professionals, usually mandated reporters, with ongoing relationship with the client in ways that help improve care. The benefits of providing feedback to this group of reporters are higher. They can provide critical information to the investigation. They may be in a position to help follow through on recommendations made by APS and services rendered to the older adults. They may have more insight into the specific barriers and facilitators to change the status of the older adults. And then there's a lower risk to providing feedback to this group of reporters because they are professionals. They understand the risks to providing, they understand the risk to allowing such an information to be shared with another. So there is that higher benefit to providing feedback to this group of reporters. So this model that we have here is what we use in framing our recommendation that we developed, and we're going to be discussing that. Subsequently, I'm going to hand it over. She's going to emphasize a bit more on this, and I'm going to hand it over now to Christine to take us through. Oh, sorry, I have one more slide before I hand it over to Christine. We actually, outside of this, which I think Kathy mentioned earlier when she was having the panel with Riza, after we conducted all of this, we wanted to see how relevant is this model? How relevant is the model I just described to you a few minutes ago? Does this really function? Is it practical? So we took this model and all of our findings, we took it to states. We conducted workshop with four different states. We conducted 2 in-person and a virtual workshop with over 70 APS staff leaders. And in this workshop, we showed them this and asked them to engage with this model. So some of the feedback we got from there is that some standardization of the feedback process and the information shared is needed. So when you're sharing information to reporters, there has to be some level of standardization. A framework for question on how to identify who to supply information to can be developed. So all of the things we have on screen that I'm not going to read through are some of the suggestions we got from the APS workshop. And Reza would also take us through some of the follow-up for their state in Oklahoma in applying some of these different ideas that came out from the workshop. They also emphasized the use of technology to advance and sustain APS messaging and the change of languages, that sometimes change of languages and the complexity between APS and CPS can become a barrier in interaction and feedback between APS and reporters. So at this point, I'm going to hand it over to Christine.
Thanks, Nikkei. And I just want to call out that we had a typo on the slide. It was 3 in person and 1 virtual meeting. And so we're so appreciative to those 4 states. Thank you. And to Kathy for being our tour guide on our national tour. So we are going to move now from that decision-making model that emerged from our research and talk about how that can be applied to actual recommendations for whether, when, and how to provide feedback to mandated reporters. Before we get into the recommendations, I'm going to ask Kathy to just tell us a little bit about some potential elephants in the room or things to be aware of as we move from the research to the practice piece.
I feel like we should title this, and now a word from the lawyer. So as we did these workshops, before we really got into the fun part, the real brainstorming and ideation, it was important to stop and talk about, like Kristen said, the elephant in the room, talk about the law. As we started this project with this grant and started to talk to even our advisory board, many people from the beginning said, oh, what about HIPAA? So first of all, HIPAA is really not an issue in terms of confidentiality. This federal law is really not most controlling. State APS programs or county APS programs may run across HIPAA more in an investigation when you're trying to get information and someone won't share it. Really, the controlling issue in a state is what the state confidentiality law says. And that will be different in each state. But from my perspective, having done law and policy for a long time, law works best if it serves the right purpose, if it's working well. And so what we ask you to do as we go through this project, describing this project, and what we ask participants to do is to just, for the moment, set the law aside. Because we didn't want people to start with a no, we can't do this. It's like, well, let's talk about what good practice is, and then return to whether or not your law supports good practice. And we found this to be a good approach because it allowed us to start better distilling, well, what kind of information? Are we talking about procedural information or substantive information? Does your state law differentiate between what kind of information you could share along those lines? And as one of the people put in the chat, client consent is also the way around any confidentiality concern. And we found that often there are opportunities to obtain client consent. It would require some process to really systematize getting client consent. But often in cases when the services have been set up, when the reporter is the person who can have ongoing support and care, you're already involved to the degree that the client is willing to consent to sharing the information. And we found that states also have exceptions in those situations. The bottom line is the law and the confidentiality rules were not in the way of forward progress as we look at how to improve practice to provide confidentiality, to provide feedback to reporters, especially as we're talking about procedural feedback. Was the case accepted or not? Kristen asked me to at least mention the proposed federal regulations for APS, which I've been all in the weeds on for the last couple of months. The new proposed regs do mention, they call it information, and I don't call it feedback, but it's the same thing. They talk about information needs to be provided from APS back to mandated reporters. And there's there are a whole number of issues in responding and analyzing that regulation. One is the cost. We went through a case study of what it took Massachusetts to change their process. Even the procedural change to create a new system, there will be a cost for an APS program to do that. Another issue with the proposed federal regs is they talk about mandated reporters, that information needs to be provided to mandated reporters. And in some states, the general public is a mandated reporter, which in our analysis at Advancing States and working with our members seems very broad. And it doesn't seem like ACL wants really to tell the whole world. So we've asked for some clarification. The regs also point to feedback at 2 points in time. One at the beginning of a case, whether it's accepted, and one at the end of the case, what the eventual outcome or disposition was. And those are very different types of information. So in our comment letter back to ACL, we really have used the benefit of the learnings from this research project to start to distill the conversation and say, are we talking about procedural feedback? Because that's different. That's just about what APS processes are, whether a case has been opened, or substantive feedback, because the client confidentiality and the state laws are most likely to be protective of real substantive feedback. And that's where we'll become more easily entangled with confidentiality. So we'll see what ACL does, because there was a lot of consistency between our members at Advancing States and NAPSA members just about the complexity of where ACL is trying to get. The good news, I think, or the biggest takeaway from the federal regs is this is a good conversation to have. The need for feedback, reporters do an important service. They are a surveillance system. And how can we honor that role and give them a little bit of information to keep them doing what we need them to do while protecting these other really important considerations like the confidentiality of the client and the confidentiality of the reporter. So we talked about that early in our workshops and can now walk through kind of the details. And then if any of you want to tackle this in your state, think about practice, come back to the law and make the adjustment in that order. That worked well for us.
Thank you so much, Kathy. Really helpful. So now we're going to take you through what our recommendations were following the research for this project and the development and reactions to the decision-making model. So in the recommendations that we provide, we pull together both this pathway diagram that you see on the left-hand side of your screen and the decision-making model to provide recommendations for providing feedback that are tailored to the specific type of reporter and that are in line with those risks and benefits that Nikkei told you about earlier. I think you can click, thank you. So I'm not going to go through, so there's a recommendation that ties on to each stage in the pathway and each quadrant in the decision-making model. I won't go through all 12 of them, but we're going to go through one from each, at least one from each stage, and show you what the recommendations themselves look like. So next. So at the intake stage, this is the most straightforward. We recommend that at intake, all types of reporters receive procedural feedback. And that all feedback at all stages should include a thank you for your efforts and to identify and address elder mistreatment, as Kathy mentioned. So what does, right, thank you, does this look like? For each of the categories, as I go through, you'll see that we provide recommended goals, content, and implementation examples. The goals for procedural feedback to all reporters at intake are to acknowledge that the report has been made and to convey to the reporter that they've fulfilled an important role by reporting their concerns. The content of the feedback can include notification that the report was received, generic information about what typically occurs during the screening process, why a case may be screened in or may be screened out, and what the reporter can expect to happen next. The keyword in this bullet is generic. We're not asking for individualized information. We're just saying, tell them about APS practice. Why in general do these things happen? And then contact information for a local agency or a specific person that the reporter can call to provide updated information about the case or to ask specific questions. An implementation example for this might include a live phone call, a snail mail, automated text message or email that informs the reporter that the case was received, was screened in or out, and whether APS will need it to obtain additional information in order to determine eligibility for APS services. Automated feedback and a voice recording for intake lines was a really interesting recommendation that came out of the workshops, and a pretty low lift way to give information to reporters while they're sitting there waiting on the phone. For reports that are not accepted, a letter, automated text message, email, or call back from an appropriate APS staff to the reporter that thanks them for their report, and that may cite the state code that establishes APS's authority to initiate an investigation. Let the reporter know that at this time it doesn't meet validity criteria, but they can contact APS for concerns or more information. And then next slide, please. In the investigation phase, so that second stage in that diagram on the left, things get a little bit more complicated. So we recommend that reporters with brief involvement, so the left-hand side of the model, still receive just procedural information in terms of feedback. For those with ongoing involvement, the type of feedback for non-professionals with ongoing involvement is the trickiest, and that needs to be considered on a case-by-case basis. Nikki, could you click? Here we go. And again, nice. Thank you. And then professionals with ongoing involvement should receive substantive feedback. So what could this look like? Let's take, for example, you can go next slide. Let's take, for example, the case-by-case feedback for reporters who are non-professionals with ongoing involvement. The goal of this feedback is to inform the reporter that APS is investigating the case and help APS gather all the relevant information they need for their investigation and to determine appropriate services. The feedback that is appropriate to provide to this particular group of reporters really needs to be decided on a case-by-case basis, because there may be really complicated interpersonal relationships, and providing substantive information in this case could be used inappropriately or even maliciously. So substantive information should only be shared here when the investigator is confident that the potential benefits of providing information outweigh the potential risks. This looks like, for example, in implementation, skilled caseworkers describing engaging with reporters who are non-professional with ongoing involvement cautiously. So asking questions that both help the reporter feel heard and help APS determine whether it is safe and useful for them to share more information with the reporter. APS may also want to work with their own legal team to determine whether it's okay for them to share information based on the specific circumstances and their state laws. Can also ask the client who they would like to share information with.
Kristen, can we go back one slide and let me cheerlead? I just want to give a shout out to APS workers, because we really got a sense as we developed this particular quadrant of the skill involved and the professionalism involved as APS workers try to sort out this particular group of individuals. Are they friend or foe? Can they be helpful or a threat? And between the APS workers themselves and their supervisors, we thought that some of the best APS practice happened in this situation, which can be the most challenged. So I just wanted to cheerlead for the work, because it's hard. This quadrant is hard, and we saw people really rise to the occasion of trying to sort that out with us. So I just want to thank them for hard that is. The case by case is hard.
Absolutely. Thank you, Kathy. Great point. And then we do recommend substantive information to reporters who are professionals with ongoing involvement. The goal here is to inform them that APS is investigating, to open the line of communication with the reporter so that they can help with the investigation, and help the reporter understand how they can help keep the client safe. So rather than just having the mandated reporter calling back and saying, "What have you done? What have you done?" Speaking with the professional with ongoing involvement, saying, "Here's what you can do. What have you tried already?" Feedback may include acknowledgement that the case is being investigated, collecting information about the case, and notifying the reporter about the progress. In implementation, this will typically occur by telephone, hopefully initiated by APS staff. And part of this is a recommendation to be proactive so that reporters are not left feeling like they submit that report and either never hear back or have to keep calling to try to get information and don't know who to call. And then APS staff may choose, they've told us of examples where they choose to share direct contact information I don't mean personal contact information, direct contact information to somebody that the reporter is encouraged to reach out to. And then next, so similarly, during the case closure phase, we recommend procedural feedback to reporters with brief involvement, case by case to non-professionals with ongoing involvement, and substantive feedback again to professionals with ongoing involvement. And what we'll just skip to the so the substantive feedback piece. So for professionals with ongoing involvement, the goal is to inform the reporter that APS is no longer investigating the case. You can provide a disposition of the case and help the reporter again understand what they can do to help keep the client safe. The feedback might include an alert that what the outcome of the case was, whether it was substantiated, unsubstantiated, or inconclusive, and inform the reporter of the services that were offered and or implemented. We know that in many cases, even if there's not a substantiated case, there are things that APS is doing. So letting the reporters know that and helping them understand that there's much more that APS is doing than they may not be aware of. And this may come in a letter, form, text, or email. And again, just letting the reporter know whether it's substantiated, unsubstantiated, or inconclusive. So let me pause there. Next, we're going to turn it over to Reza to tell all of us a bit more about how this is going in Oklahoma. Reza?
Awesome. Thank you. So, one of the things whenever, after we completed our session with the team, Kristen asked us, why are we so motivated and gung-ho to try to make improvements? And, it started, a few years ago, whenever we were trying to implement a specific culture within our organization. So I added this slide right here, purpose, autonomy, and mastery. That's what we try to accomplish in our organization. And these are just 3 key values that we need to enable to create creativity and enable change for the better in a workforce. So again, you got your purpose, right? Everybody in this field has purpose for the most part. I mean, if we didn't, why would we work in this organization? We're trying to improve people's lives. Next, we want autonomy, right? The ability to make change where we know it needs to be made. And everybody that's on this call or supervises somebody that assists somebody else, we want autonomy to make changes in order to improve the outcomes. But we can't necessarily have that autonomy without the skill set necessary in order for us to make those changes. So that's what mastery is. It's the skill set. The skill set to know that if I make this change, I know the secondary, tertiary reactions that happen when we make changes. So this is what we try to create. And we do this through these simple questions. This is our Hope Coaching methodology, where we look at what the long-term goal is, where we are now, right? That creates a gap. Then we have brainstorming sessions on what are the barriers, right? And we want to identify as much things in the way as possible. And then we want to create pathways that provide expected outcomes. One thing we don't do in Oklahoma is throw spaghetti against the wall, right? I'm going to do this, 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 and this, and then whatever sticks against the wall happens to be what worked, but we don't really know. And it makes it harder to scale when you don't know. And so that's why it's important for us to pick a specific outcome that we want to attain, a specific pathway, and have a specific outcome. And then we hold ourselves accountable, which is, when can we see if it worked? That's really the learning moment, right? I did something. We want to go back and see if it worked because we're still trying to accomplish that long-term goal. And so whenever we look at that, we say, what went right? What went wrong? What are we going to do next? Because the goal we set is still important. So I wanted to share that with you all because it's just kind of the groundworks for setting change and giving it a positive vibe every single time we take a step. This is kind of a good visualization of that framework, right? We only know what we know, and that's what that red line symbolizes. We want to be somewhere. How we move forward is, it can be deliberate or it can be a guess, right? If we're trying to herd cats, I got people going every which way. If we know which direction we're going, then and we engage that process, then we can start iterating. And at a recent workshop we did, you know, I said sometimes the step back is the right step to take because your organization needed to learn it, right? How many of you all wish that you could have just told your kids that just do it like this and they would have done it? But no, they had to learn it for themselves in order for it to take root and take hold for them to continue that process. So again, this is just a good illustrative process of how we move forward in Oklahoma. Next slide, please. And then again, we address these kind of mindsets head on. I know Kathy just said a little bit ago about, is the law in our way? I mean, laws, rules, policies, those things were written by people with the best information they had at that time. That doesn't mean they shouldn't change. And so every time we think something's in our way, instead of saying it's in our way, say, how do we? And how can we, as opposed to we can't? Or it's broke, I can't. You know, again, I was in the military. I used to think there was only one way to lead, and that was by telling people to shut up and color, right? That was what I was told. And so that was my leadership example. But by owning the mindset that we're trying to create creativity in the workforce, that really helps us take form and move forward. So as we looked at those lessons, and then we're moving forward and we're looking at this initiative, we got to look at where we're trying to go and what the data tells us. Right here, this is the number of referrals that we received over each fiscal year, right? And this past year, we were at 28,500 almost, and we're on pace to be over 30,000 this year. So that's quite impactful whenever you're looking at what we're talking about providing or how much time it takes our team in order to respond, right? How many times do we get an email or do we need to email somebody? And again, what does that do for us? So again, this sets the stage for what the impact can be based on if we can implement something that can be automated. Next slide. And this is data that I pulled, I want to say a week ago from our system. So impact of automated messaging. When a message is received, it's not just a message, right? It is time taken away, task switching. And people say that we multitask well. I mean, to me, I feel like that's a myth. And we switch from doing one thing that we were working on, and then ding, an email comes in or a request comes in for information. And we shift our focus on this, find that information, send it to whoever it was. And then we have to get back in a frame of mindset to go back to the work that we were doing. So that's an extra 10 to 20 minutes potentially every single time we get or we need to create a message that goes somewhere. So, you know, again, assuming 20% of the referrals requested an update, that's 40 or almost 5,000 emails, right? And that's if only one email is received. And I bet everybody in here has seen the multiple messages on multiple things. So the more that we can focus on automatic messaging, the more that we can provide time back to our staff to where they can truly help and focus on the clients. And so when we were just talking about the procedural versus case by case versus substantive feedbacks, we aren't just preventing substantive or case by case. We're actually enabling it because we have reduced the amount of time it takes to do the procedural feedback to everybody else. And again, whenever you're looking at 30,000 referrals, that's a lot of time. And just running the math on this, that's 1 hour per team member per week. I ran the math and I forgot where I put it. It was like 2.5% of their time with just these numbers, right? And who doesn't love more time in their day to focus on what needs to be focused on, right? Procedural feedback is something anybody can do, right? And we need the brain power of our frontline team members where it really matters and not on stuff like this. So again, this is one of the reasons why we're focused on making improvements, because the more we can not have to do these things, the more that we can help other things, right? All right, so next slide, please. So whenever we look at our system in Oklahoma, I want the work to do the work for us, right? So whenever we accept or whenever we get a referral, that is a trigger, right? Whenever the referral triggers from accepted to screened, that's another trigger. Everything is a trigger within our system. And once we understand the triggers required for procedural feedback, we can make the work do the work for us. And if we can utilize technology to do that, then we're alleviating the challenge that we have, because manpower is something that we can almost never get. I'm sure everybody in here feels that same way. So we have to engage our creativity in other ways. And by doing these things, we reduce task switching, we reduce emails, we reduce other communication, and it enables us to be that creative force to solve other problems that we don't need to be solving anymore. And then just for a quick view, and I know this might be hard to see, I kind of squeezed it all down, but whenever these slides go out, you should be able to zoom in and see them pretty good. And this is just a first draft. There's been a couple questions that I've seen in here on, say, for instance, an alleged victim or the client does not want to share information. Well, we could say, we could have this process right here modified to say, does the client opt out of having somebody notified? And then boom, procedural notifications are left out. And so our team helped come up with what this can kind of look like and how we can guide procedural feedback that is safe for our client, safe for anybody that might receive it, just by preempting a few of the questions and then guiding that process. So again, this is just a quick oversight, not complete, something we're working on, iterating and improving on our next enhancement phase with our APS system. So that's our quick overview of what we're doing in Oklahoma and how we're moving forward and why we're moving forward. And again, I hope that you all find this valuable.
Thank you so much, Reza. It's incredibly valuable. Thank you. So now we wanted to do, before we turn it over to a full group Q&A, another quick panel. And so Reza, thank you so much for that overview in Oklahoma. Achilles, I'm wondering if we could turn to you and say, how does this resonate with you in terms of what's going on in California and where you might see some inroads?
Thank you. I think this project helps inform the path that we've taken to fine tune it. I think Reza's presentation, it really resonates because you can see the amount of work that it can generate. There is value, and there has to be some system and funding supporting it, right? So just imagine, the Bay Area, we have about 50,000 reports a year. Los Angeles, 55 to 60,000 reports a year. And that's just like a small segment out of 58 counties in California. So for county administered states and jurisdictions, this is very helpful in really focusing on what is the value, or what is it to be and how can we move towards something that is consistent, that is really helpful. Because ultimately, everything that we do, is ensuring the safety of an older adult, an adult with disability in California who's in harm's way. And we need those individuals who are gatekeepers, who are engaged, who can be part of the solution. So the education, the information has to be consistent. I really like the being thankful because of their report. I think the message there is that there is value in what they're doing. And even though there may not be abuse as defined by our code, simply the reaching out and something that may turn into some help in some way, or a full-on intervention that really helps someone, and developing a system around them that is helpful. And all that happens with information, with communication, with our reporting parties feeling that they can report again, they know what is happening. And based on the quadrants, how do you decide what information you provide, and how, like Kathy mentioned, what does the California law support in us agreeing as 58 counties with leadership from the California Department of Social Services, for example, what would be a consistent way of applying some of these concepts to bring value to ultimately our APS clients. And for San Francisco, here for us to revisit some of the changes we've made so that we can align with best practices. And I think that projects like this and research like this do help inform or local, we have city attorneys, for instance, that review our practices. And always the question is, well, for us to interpret what you want to do, where is a best practice? Where does it say it? And so all of this information is helpful for what we're trying to do in improving our process.
Thank you, Achilles. Really, really helpful. Kathy, you spoke nicely already about the kind of alignment between this work and the information in the proposed regulations from ACL. Is there anything else you'd like to say about the alignment with the regulations? I know there's the specific one around feedback, but anything else about how our research here might apply to the regulations as a whole?
It'll be interesting to see what ACL does, because many of us who provided comments were very specific about the cost burden in providing this information. But I think there's likely to be something that comes out in the reg, and hopefully that we can inform that recommendation with this research. And really, I think what we've been able to do is improve the conversation. I think we've been too broad brush when we've talked about feedback or information into thinking it's all things to everybody, and that's not at all. It's not what the regulation says now, and it's not what our research finds as well, that we can advance the field and advance the practice if we do nothing else but focus on procedural, so that we keep people doing what we're asking them to do, which is to provide feedback. And to the degree that confidentiality is an issue, it's a state law issue that needs to be revisited. I think, as a lawyer, I think we help the lawyers if we break things into procedural and substantive, just to start the analysis of what's possible. So we'll see what ACL does. What we do know is this is timely. And I think we've taken a big leap forward from sort of a general angst we've all had. All those reporters, they're unhappy. They're saying they're doing a job for us that's important. How can we assist in a way that protects confidentiality? And I think this is a great time to have both of these conversations, our research with practical implications and ACL looking at the regs.
Thanks so much. And then Reza, your presentation was so fabulous. I don't actually have any more questions for you, but any last words before we open it up to the group for questions and comments?
So, even though our focus right now is on the procedural, what's really cool is once we've established and got something like this down, our ability to see what comes after the procedural feedback is that much more empowered, because once we see one thing, we can imagine the next and the next, even though that next thing might be impossible right now. By freeing up time and creativity to be able to look forward, just doing that alone is so refreshing and empowering. So, I mean, all I can say is keep putting one foot in front of the other and keep striving for greatness, and we're going to get there.
Wonderful. Wonderful. And before we open the mics for Q&A, I just want to recognize, so thank you to everybody on the presenter view here. And also thank you to the other states, Kansas, Washington, and Utah, who participated in the workshops, because a lot of this work came out of what we learned from you all there, and to Massachusetts for participating in the case study, and to all of the states that participated in the interview. So just thank you for being willing to share your experiences and your advice with us. Can we open the mics and see if anybody would like to ask any questions or make any comments?
Yeah, they should be able to unmute themselves if they have any questions or comments. Going through the list.
Chat as well.
I see 2 comments from Eddie and Kim. I don't know if they want to come off mute or just leave the comments there if you want to address the comments in the chat.
So Kim, I'm wondering, we did not mean to suggest that we don't think that there should be a central intake line. We wanted to raise the point that for some reporters, it takes a little bit of the kind of personal approach or feeling of a local community response to elder mistreatment out of it. So they also noted in the case study that it was really important in terms of ease of use to have the web intake and the central intake line, and that when the feedback time comes, it would be good to also provide some sort of local contact in that as well. So just wanted to clarify that. There's a question about whether this was recorded. It is still being recorded. My concern.
Can I address Karen saying her concern would be protecting the anonymity of the reporter? When we did the workshop in Utah, the issue of the confidentiality of the identity, or the protected nature of the identity of the reporter, was a big part of the conversation. And Chris and I do a little bit of crosstalk because we had a conversation about, do the reporters, are they willing to consent for their identity to be known? Because I think they had some anecdotal information for us that if they ask reporters, do you want your information to be protected? The vast majority of reporters said no. So this would be a state-specific thing to work through, and a process piece where you would want to tell the reporter you have a right to remain confidential. Do you want to remain confidential? So that would be one way to start parsing through, sort of the mirror equivalent to the confidentiality of the information about the client. Process can overcome some of it and still respect sort of the fundamental nature of that protection in the statute.
And also to that, Oklahoma, has mandatory reporting, and we allow people to remain anonymous and give them an option whenever they call in to be informed that they can stay anonymous, or even on the online. And in the model that I added on the slide, one of the first questions that we have in there is, does the reporter wish to be updated? So for instance, in that model, they can opt out initially, especially if they're on the low end of wanting that contact. So they just opt out of that procedural contact, and then we just keep moving forward and work our case.
Hi, this is Taryn Lee Turgeon from Executive Office of Elder Affairs in Massachusetts. I just want to speak to what Kathy said. When we do our mandated reporter training, especially with councils on agings or nurses and people who are working with that client, we encourage them to say, hey, I'm concerned, make a report. And then we can also use that reporter to get in and continue to build rapport. We do have the confidentiality state and law, obviously, but trying to gap that bridge and have the person, sometimes the older adult can figure it out. The only person in the situation was the nurse, and that's who the elder, told everything to. Most of them are going to figure it out. So we do encourage, if you were kind of alone and you want to help with this situation, you can make yourself a part of this assessment at that point, and let the client know that you're calling or you called.
Sandy has her hand up.
Yes, I work with Reza. I work as an APS2 in Oklahoma, and when going out on visits and talking to clients, we are never allowed to disclose the reporter, even if they guess. All of our responses are basically, even if I knew, I'm not allowed to tell you. For that reason, that tends to quiet the victims down a little bit, and helps build rapport with them. The other thing is that when we're talking with reporters, if we have them listed in the case, they are not listed. They are listed as collaterals, and that's how we address them, as collaterals. So they are never mentioned in the interview process as the reporter for that reason. at least in our system anyway, in the way that I do things. So I just wanted to come on here and let you know a little bit more about what we do in our little neck of the woods.
I appreciate that. Yeah, and there's a couple of comments in the chat too about disclosing the reporter to the client, which is really important if you think about client consent and wanting to be able to ask the client, can we give this information back to the reporter? But just to clear, we're talking mostly about providing information about the case to the reporter about the person that they reported. I just want to make sure we don't get confused about who we're trying to talk about and to. Sharon. Actually, Reza, did you want to say anything to Sandy's comment, or you all know each other?
No, she was just reiterating, just some of our standard practices. We want to protect the client utmost, and we want to reinforce that if somebody calls in, they're going to have protection. They're not going to have to feel intimidated in some way, shape, or form throughout the process of, I made a call now and then I see something else and I'm not, because that happened previously. So she's just reiterating that process and why it's important that we stick to that standard.
Yeah, this is Sharon, and I also am in Oklahoma, and I'm a supervisor for our screening unit. So my team sees every single referral that comes in for the state. One of the issues we have found is the reporters who select to be anonymous whenever the referral is made, they may call back a week later, a couple of days later, and they want information on the referral. Because they're not on that referral, we cannot provide them that information. And, we get a lot of irate reporters, but due to the confidentiality, we can't just tell anyone who calls and says, oh, I'm the one that made the report. We cannot provide any kind of information. So that seems to be an issue. And that may be some of the information, some of the concerns for reporters in your research and not getting that information. My question would be, were they asked, did you provide your information when you made that report?
Yeah, one of our challenges here in Oklahoma is, how do we control the public? And the answer is we can't. So they get to still do what they want to do. We continue to work and enhance the process. And again, we're not letting perfect get in the way of good. So we're trying to say, all right, here's what we ought to say to reduce the number of those types of calls that we get. But yes, it is still a challenge that we very much have. And again, we're just working to iterate that process.
Thanks, Reza. And my sense from the research that we did for this specific project and all of the many conversations and qualitative work I've gotten to do with both APS and mandated reporters is there are a lot of misconceptions among mandated reporters about what APS is, what APS can do, what APS cannot do. And I think this is where that procedural versus substantive information separation becomes really helpful, because I completely understand that in many states, it's a heavier lift to get substantive information to reporters. But for many states, using the reporting process as a means of educating mandated reporters about what APS is and is not, and what they can expect next, and what types of reports are appropriate for APS in their state, may help to ease some of that tension among the reporters about APS doesn't do anything. I make a report and nothing happens. So using that as an opportunity. I mean, I just thought the suggestion we got at one of the workshops for, instead of music at the intake hold line, play information about APS. I mean, how brilliant is that idea to just use the time the reporter's probably on there getting frustrated to tell them something about what they can expect. So I think there are kind of smaller lift things that we can do. And I love the idea of client consent if it's possible, understanding that it may not be possible at this moment for every state to go to a client and request to have permission to share information with a specific person that's a reporter.
That was
Kathy?
Oklahoma, Kristen. That was Oklahoma. The old Mhm. Yeah.
Yeah, Christine, that's a big takeaway for me, for San Francisco, front loading people, they need to know what to expect. I think that goes a long way in terms of their perception of the agency, the value, and also it may help mitigate and follow up contacts when they don't know. And I think that having a system, a procedural system that really educates timely when the person is making the report can go a long way. And I think that is there, and thanking them as well for what they're doing. The value of taking that action is not easy for many people to decide to pick up the phone and make a report, maybe because it is a client or someone they care about or a neighbor. It is a big deal. So being thankful about that, I think it is also speaks about the program and the nature of the service.
Thanks.
Yeah, if I may also add, I think from our work, we spoke to, like I mentioned during the presentation, 44 APS leaders, and majority express that they understand the need for providing feedback to reporters. So there's an understanding of the benefits. I think the major aspects where each state might need to look into is identifying specific barriers in the state levels and current facilitators. How can we optimize our current system? And how can we address the barriers that impede the opportunity to communicate effectively with the reporters? I think the ultimate goal for whether you're a reporter, whatever agency you belong to, is to advance the well-being of the older adults. And working hand in hand with reporters, we heard that over and over, especially in Massachusetts, we want to be part of the team. So both the reporters and the APS agencies and staff are looking to advance the well-being of the older adults. And if there is any way to work as a team with the reporter to enhance that process, I think maybe that's what we're asking here. That's one other takeaway from the reports is looking at the report, taking time to evaluate it as a state. What can we identify that can help facilitate our current or optimize our current system to improve communication with reporters and importantly, improve our response to older adults experiencing elder mistreatment.
Nice, Nike, thank you. Yeah, and if there are states that are listening to this and kind of interested in that process that Nike is describing, the link that I put in the chat with our full report does include the worksheets that we used at the workshops that we held, and those may be helpful for you in thinking about engaging in a process with your staff to see what might be possible. I see a comment in here from Taylor Hunt. One of our main problems is the reporter is a neighbor or family member that wants to start drama. Yes, that we heard loud and clear in our research. And that's why for the recommendations, we really said for non-professionals that have an ongoing relationship, like a neighbor or family member, you have to make a determination on a case-by-case basis. We can't say whether they should be provided necessarily procedural or necessarily substantive feedback. And that is, as Kathy noted earlier, where the skill of the APS workers really comes through, that the seasoned APS workers describe to us different ways that they're able to interact with the family members and get the information that they need as APS without giving too much information back to that person, that reporter, in case they're wanting to use it in a malicious way, but also helping that person feel like they're being heard and that they're part of the process. And so that skill can come, I think, with time and training and by working with colleagues that have been in the field longer. And also, as we mentioned on that slide, sometimes you do need to consult your legal team and say, this person's asking for more information. Am I able to do that? So thank you for that important point. Mental health institutions making the referrals, but will not provide any information that would assist with our investigations.
Yeah. Well, again, this goes back to where there isn't a silver bullet to fix it all. That's still a separate issue that we'll still have to work through. Yeah, it's a challenge. One that we'll put brain power to and solve hopefully in the future. we can only do what we can do, you know, and a lot of times other agencies also, well, I hope that they choose to employ a model that works to achieve what we've worked to achieve at the Oklahoma APS.
Thanks for that. Any other questions or comments in the last few minutes? Oh, thanks, Nikkei. Right. Well, again, I want to thank the team here for presenting this work and all of you on the line for tuning in and learning more about our work. I will put my email in the chat. And if anybody has any follow-up questions or would like to talk more, Kathy, thank you. I see Kathy Wood in the chat there. So here's my email address. Welcome your feedback, criticisms, questions, ideas. And we do hope in terms of next steps that we could apply for follow-on funding to be able to test some of the recommendations in action. So if there's any interest in collaborating in the future, please do reach out.
All right, I will stop the recording.